gurgling a bit, but there's no obstruction in her throat. She doesn't appear too dehydrated, and her membranes are moist. When did you stop nursing?
Yesterday. I wasn't too worried at first. My boys were both finicky eaters, but when she wouldn't nurse at all today, then...
Any fever or vomiting?
Oh, none. She's been a bit cranky. She's been napping longer than usual, but that's about it.
Mama, I'm thirsty.
Okay, baby, we will get you a drink as soon as we speak to the doctor, okay? All right? No, I'm so sorry. We go to the park every day. They're exhausted. My husband will be here to help any minute.
Don't worry about it. Let's get a CBC, CMP, and abdominal ultrasound and a babygram.
Yes, a babygram.
An X-ray of her entire body.
So this could be serious.
There's no way to know for sure just yet, but I want to cover all our bases.
I should have brought her in sooner. It's just with my husband at work.
You were juggling 3 kids, okay? I get it. I only have 1, and it's a handful. I will fill you in as soon as we know anything.
Thank you.
Timothy Williams, 8 months old, diagnosed with hypoplastic left heart syndrome. Brian, can you tell us what that is?
I know. It's a congenital heart defect. Left side of the heart can't efficiently pump blood, so the right side has to pump it to the lungs and the rest of the body.
Correct. Now, Tim is on the heart transplant list, but he's developing fluid around his lungs, a pleural effusion. He requires a thoracentesis to drain it. The patient is sedated, and the ultrasound shows the fluid surrounding his right lung. Lidocaine is injected just below the surface of the skin, forming a wheal. We go through the wheal and into the pleural space, staying above the rib because the blood vessels are below. If you go too far, you puncture the lung. Once you are in, aspirate the fluid. Give us a minute. Gail, John, I think it's best that Tim not leave the PICU going forward. No more trips downstairs.
You mean keep him on the vent?
He's not oxygenating well. His lungs are very congested.
He's gonna get a heart soon. Listen, everything's gonna be okay, you hear me?
I'm gonna check the transplant list. See if there's been any movement.
Thanks.
Hi.
Hi. My husband, Andre, took the boys to get some food. He'll be back soon. Any news?
The blood test and babygram are okay. Nothing abnormal in the abdominal ultrasound either.
Thank goodness. Dr. Manning.
May I take a look at her?
Yeah, thank you.
Do you have any family history of neuromuscular disease?
No, none.
Her deep tendon reflexes are diminished. She's floppy. Her muscles are losing tone.
What is it? What do you see?
A baby's natural position is to flex the legs. And once straightened, there should be some resistance.
Let's get a CT of her head. I want to make sure that there's no swelling in her brain.
Swelling in her brain?
I don't know that that's the case, but we just have to check. If the CT comes back negative, then we will do a lumbar puncture to test her spinal fluid.
Why?
That'll let us know if she has an infection.
My poor baby.
Just hang in there, okay? We'll know more soon.
That is one sick baby. What do you think is going on?
I have no idea.
Her lips are turning blue. What's happening?
Excuse me?
She's in respiratory distress, unable to contract her diaphragm and chest muscles enough. I need to intubate now.
Rosal tape.
Mr. and Mrs. James, I'm gonna need you to step outside, please.
Stats falling, heart rate stable.
Pharynx is collapsing around the scope. Need correct pressure. Suction.
Stats still falling 40%. Heart rate dropping is at 60. Atropine.
Not yet.
Been a minute. Heart rate 30, O2 set is 0. We're running out of time.
I got it. I'm in.
Give the atropine.
Right away. 0.5 body push.
Sat's coming up. Heart rate 130, Sat's 99.
How long does it take to intubate?
Almost 2 minutes.
Pupils are fixed and dilated. I'll pick you for a bed.
Got you.
I should go talk to the family.
You want me to join you?
No, I got this. Thank you.
So what does that mean?
There could have been a brain injury due to lack of oxygen. We're running a cerebral flow study to make sure that blood is reaching her brain.
This isn't happening. Yesterday, I was singing to her in the bathtub, and now she's hooked up to all these machines, and nobody...
Dr. Rhodes!
Code blue. Code blue.
No pulse.
All right, start compressions. Get him off the vent and bag him. 0.07 milligrams of epi. He's in V-fib. Charge to 15 joules.
Charge 15.
Charged.
Hold compressions. Clear. We're back in science rhythm.
We have a pulse.
Hey, can I talk to you for a second?
Sure.
I'm not here.
What? No. No, absolutely not. I'm still working on a diagnosis. What you are asking me to do is premature and completely unethical.
Natalie, please. You're running a cerebral blood flow test for Alicia. You clearly think that brain death is a possibility.
A possibility. But I will not get those test results back for another few hours.
So all I am asking is that you speak to Alicia's family about organ donation. Look, just let me run an HLA test. Just to see if she's a match. Just should the worst happen.
Okay. You know that if I do that, I am insinuating to her parents that she's definitely gone. You are putting me in a terrible position.
You're right. When Tim was born, he wasn't breathing. I performed his first surgery. When he came to, I was the first person he saw. And he put his hand around my finger. Please, Nat, I can't lose this kid.
Organ donation. So Alicia's brain dead?
The test results have not come back yet.
Then why are you even here? Asking us to cut up our baby.
No, that's not what I'm saying.
Have you given up on her?
No. No, I swear. I am doing everything in my power to diagnose your daughter.
I don't believe this. Alicia's life is hanging in the balance. Our baby girl.
Andre, just...
No, she's saying that there is no hope. But there is. Alicia is still alive. She's supposed to be our doctor.
Mr. James, please. I know that this is difficult to process. But the reality is, we don't know what the test results are going to say. And right now, there is a baby fighting to survive. A baby just like Alicia.
What would it require?
We already have Alicia's blood. All I'm asking is that you allow us to test it.